would like to call to order the March 1st, 2021 Cabarrus County Board of Commissioners work session. Welcome, everyone. It seems like just a few minutes ago that we were all together as we spent the weekend together at our planning retreat, but I'm glad everybody had Sunday to recover and be back with us. This is 1 year that we have been meeting virtually. And even though it's not an ideal situation, I think all things considered, it has gone very well. And I think we've done a better than adequate job of learning how to operate our technology and make these things happen. So we have certainly made the best of it. Based on conversations with different staff members and board members, it appears that hopefully in the month of April, we will be able to return to our in-person meetings. Fortunately, our COVID numbers have improved significantly over the last weeks. Cabarrus County has moved from a red county to orange, and certainly trending in the right direction that maybe by April it'll be considerably better than that. And so staff is working on a plan so that we can meet in person and still have adequate social distancing and take precautions to make sure everybody's safe. So hopefully all of you are as excited as I am to once again be able to get back together in person. So wanted you folks to hear that, as well as the public, to kind of know what our plans are, and that's the direction that we seem to be going. First up is approval of our work session agenda, including the changes on page 3. And I think all of you have a copy of that before you. So at this time, I would entertain a motion to approve the work session agenda, including the changes on page 3.
Mr. Chairman, I'll move.
Okay, we have a motion by Commissioner SHUE, and I didn't catch, somebody made a second, but I didn't catch who it was. Diane. Commissioner Honeycutt makes a second. Okay, is there any discussion? Hearing none, all in favor, please say aye.
Aye.
All opposed, please say no. That motion passes. We will move now to discussion items for action, and the first item on our agenda is appointments to boards and committees. And you all have a copy of those. We have pretty fair amount of those this month. Is there any item that anyone would like to discuss in our appointments? And I think there are recommendations on all of those from the various involved groups and departments. Okay, hearing none, we'll move to item 3.2 from Cooperative Extension, 4-H After School Cannon Foundation Grant, and we are happy to have Robbie Furr with us to talk about that one.
Thank you, Chairman Morris. It's good to be here this evening or this afternoon. So the Hayes Charitable Trust with her. So we've been thankful to have this grant funding since 2013. It's been renewed each year since then. We received word that the grant was renewed again for this year. They actually increased our funding up to $25,000 this year, which allows for the part-time staff member we have to work a few more hours in a week to provide some more programming with our sites, and to also put some more kits together. They're adding in some home kits, so these young people can take kits home and do programming at home with their families. And so this is just, we have this before you to request the acceptance of these funds into our revenue line, and then to allocate those in our expense lines according to the budget amendment we submitted.
Okay, thank you, Robbie. That is certainly good news, and we certainly are appreciative of the ongoing support for this program, as well as a number of other areas from the Cannon Foundation. Does anybody have any questions for Robbie?
Mr. Chairman, I don't have a question, but I do have a comment for Robbie. Robbie, do you have to apply for that grant, or does it come automatically pretty much from the Cannon Foundation, or do you like a reoccurring application?
It doesn't happen automatically. They do send a request for us to renew. So there are funds for folks to apply for new, and then we have been thankful that I think the last 4 years they have reached back out to us and request that if we would like to submit a renewal, and that's how that's worked. It's a much slimmer application process.
That's good. I appreciate your effort, Rod. Thank you.
Mm-hmm.
Okay, any other questions or comments? All right, thank you very much, Robbie. Okay, we move now to item 3.3, resolution designating the county manager to make recommendations for ABC permits. And we are happy to have Deputy County Attorney David Goldberg to talk about that one.
Good afternoon, Commissioners. This is a pretty straightforward resolution. We're a dry county. We don't sell. Cabarrus County does not sell, alcohol of any kind in the unincorporated areas. But there are some rare exceptions where someone can apply for a retail permit, and if that does occur, the law requires them to notify the local government in which the establishment is being proposed, and the local government then has 15 days to object. So it's very rare for us, but it has happened recently. And technically, the Board of Commissioners is supposed to receive that notice and object through a vote. But they can, alternatively, you can designate an official to respond to these recommendations, as is the case with pretty much every jurisdiction in the government. So taking up the norm, we recommended identifying the county manager position as being able to respond to these local government opinion requests.
Great, thank you, David. Any questions that any of you might have for David regarding this item? Okay, it sounds like an efficient way to handle those requests, and hopefully we can move things along a little faster for folks rather than waiting for the board to meet and act. Next item is item 3.4 from the Cabarrus Health Alliance, and we are happy to have Director Bonnie Cole with us to talk about this item.
Good afternoon, everyone. As many of you are aware, the Cabarrus Health Alliance has been actively vaccinating our community members for the past 2 months, doing 2 to 3 clinics per week, and we are at the point where we have vaccinated over 20,000 community members. We're also continuing to do the case investigation and the contact tracing for the hundreds and sometimes thousands of cases that we are getting weekly and monthly here at the Alliance. When we sat down and started looking at the costs of holding our clinics, we are doing drive-through clinics out at the arena predominantly. We are also doing strike teams where we have groups of nurses going out to various long-term care facilities and other congregate settings. We also have a strike team going to El Puente to try to reach the minority population. When we calculated all of our expenses up of doing the drive-through clinics and the other sites, to maintain 2 to 3 clinics per week indefinitely, we will need on average about, we have been spending about $235,000 a month for all of this. We would, and we would continue to need about that much. We've found ways of getting the costs down a little bit, to where we would need about $185,000 per month to continue that. As we look at the known funding sources that are coming in, we would be coming up short by the end of June in terms of being able to maintain this consistent vaccination schedule to reach the most county residents that we can potentially reach. And we looked at other funding sources that have funding streams that continue on for the next 24 to 30 months, and then approached Mike Downs about whether there were some additional dollars left from the county, from CARES funding or other sources to help us stay whole this for the remainder of this year. We would need approximately $250,000 to get us from February to June in a break-even status, supporting the clinics at the pace that we are holding them. So we are respectfully requesting if that money, if the county does have some funds remaining, that they might allocate some of that to us to cover largely our vaccine expenses.
Thank you, Dr. Cole. I just will take an opportunity at this time to say that I have heard nothing but positive comments about the clinics that the Health Alliance are conducting for the vaccinations at the arena and elsewhere. Folks in the community that I have spoken to have sincerely been appreciative and complimentary of the way that it's been handled. I think Commissioner Honeycutt has been volunteering for several of the sessions out there. There may have been other commissioners as well, but it truly has been a community effort. And if we have this CARES funding, I think that's what it's designed for. Commissioners, do you have any questions for either Bonnie or Mike regarding this item?
I have one. When this Johnson & Johnson vaccine comes online, that will not create any need to extend the days?
To extend the day?
The vaccine days, I mean, will your
Hold additional clinics? I'm sorry, it's breaking up and I'm not hearing what you're saying.
Can you understand me now?
I can hear it, yeah.
When the Johnson & Johnson vaccine comes online, will that create enough supply to cause you to have to look at more days, more hours, or it will just keep things consistent?
It could create the need for additional days. We suspect with more providers coming on board in our county that it might just simply be that the state distributes the vaccines to additional providers. We have not gotten any direction or indication yet from the state regarding how that might change allocations. We're hoping to hear this week about what the plan will be for that. I can give you an update on that as soon as we hear, hopefully even as soon as tomorrow.
Right.
Thank
Okay.
you.
Any other questions for Dr. Cole?
Mr. Chairman, I do. This is Lynn. Dr. Cole, thank you for all of your effort out at the arena and elsewhere that you're putting forth to get our citizens vaccinated. And you've got an awesome crew and a bunch of good volunteers out there. But my question is, the funding that you're requesting will make you whole up until June. Is that what you said?
Yes.
January through June? Dr. Cole, could you hear me?
No, it stopped. I didn't hear the question at all.
Okay, the question was the funding that you're requesting, is that going to take you from February through June? Is that what you said?
Yes.
Okay, now for the county manager, do we have another income stream or revenue stream to carry us from June 30th forward? Or are we thinking that this is probably going to come from the new funding that hopefully the Senate will pass sometime in the next short while, that will get more monies out to states and city and county government.
I'm having computer issues. Can you hear me?
I can hear you, Mike.
Yes.
Okay. Yes, sir. There are funds available for this. As you know, you allotted an amount for our nonprofits, and we reached out to them on the first round, and they are working through those funds there. There was some money left over, and Rodney can give you the exact numbers, but there was some money left over, so we can pull some of that money that has not been assigned to anyone yet to finish this out at the 250,000. There will be some more if this continues on as well, but we just have to spend it by the end of the year. So Rodney, can you give them the actual numbers?
Yeah, all told, we have roughly $1 million remaining that has been converted to county money, but it originally was the CRF money that came through the federal government. So we have about $1 million left. So that would come out of this 250,000, which would still leave us with about $750,000 left for needs that might pop up between now and June.
Yeah, well, that's great, Rodney. I appreciate it. I know that when we talked at our retreat on Saturday, you was aware of the new, I can't remember what they call it. You know, they've got different acts though, but there's going to supposedly be some more funds set aside for that. Do you have any idea what we possibly could get from that new relief bill if it get it passed through the Senate?
Yeah, nothing official yet. So it looks like it will pass the Senate likely later this week, and then we should get more information about our potential allocation. But we've done some rough numbers, and it could be a relatively significant amount of money in the neighborhood of $20 to $40 million, but it would have specific purposes, obviously.
Right, and that's what I knew. It was upwards of 40 million or thereabouts, but it always has strings attached to it, what you can use it for and what you can't use it for. But my concern is that obviously this is going to go on for a while, with the vaccinations and all the things that we're having to do to protect our citizens. And so what we're going to do whenever we vote on this on our general meeting, then from July the 1st, sometime between now and then, we'll have some information about what we'll be able to get, how to allocate that will carry us on through for another 6 or 8 months maybe. But that's all. I just wanted to make sure that we got enough to cover this, because it's definitely an out of the ordinary expense from what we're used to.
Yes, sir.
Thank you for your information, Rodney and Mike.
Yep.
Okay, any other questions on this item? Okay, thank you very much, Dr. Cole. Okay, we will move now to item 3.5, Kannapolis City Schools funding request. And I think Rodney will talk with us about that. And I think Dr. Buckwell is also with us.
Yeah, so I'll let Dr. Buckwell cover the specifics. I'll touch on the funding real quick. So the board will recall that each year we budget a contingency for charter schools, and that's because we don't know the number of Cabarrus County students that will attend a charter school. That contingency amount will not be needed in fiscal year 21, the current fiscal year. So we do have that funding available for this purpose, which would be to replace the boiler at A.L. Brown, as well as to do the master plan study. So I'll let Dr. Buckwell talk about the specific uses.
Thanks, Rodney. First of all, thank you guys for having us today, and I'll go over the master plan study first. If you recall, when Cannon Gym was condemned and we came to you guys to see what we might want to do with that, the idea of doing a master plan because of school classroom size needs or classroom needs at the school were part of the issue. So we've engaged with architectural firms. Our board has met with the finalists in that, and have made a selection. And this is the $88,850 is the contract with Little Architecture to complete a campus master plan for A.O. Brown High School. We would use this master plan to help guide facility decisions in the future because they're going to, what we went over last week and on Saturday, talking about future growth in Kannapolis, we're going to have more classroom space. I'll take questions about that first if you want me to do it that way, Mr. Commissioner, Mr. Chairman.
Okay, questions for Dr. Buckwell.
Dr. Buckwell, just very briefly, and Little is a very good firm. Are you guys giving them some direction on where to go and what you want to see, or are they taking the campus as is and then
left the call. Rejoin.
Yes, sir. So what we did was we had a general meeting with any architectural firm that wanted to participate, and we talked about the extra classroom space needed. We had a campus. We visited the campus. We talked about the current CTE, our career technical education, our arts areas, our core instruction areas, which are primarily our concern, and the need to either recondition or replace the Cannon Gym. So there were some parameters around which we guided them, but they were all free to kind of have a plan around what they saw as the needs of the campus. And one of the major areas was, we've always been concerned about this, was access to the campus in general, because it's more like a small college or a community college campus versus the conventional high schools that we now build. So we were have always been concerned about that. And so we added that to the issue of what they would look at and the kind of the overall structure of what they could present back to us. But our primary concern is additional classroom space and how we would make that work.
Okay. Well, it sounds like you did give them some direction, and the reason I'm asking, it's just a fine line between you're paying them because they are creative and that's their talent level. And if they didn't have that, they wouldn't be in business. But you also sort of have to put some parameters on to make sure that they understand that when they're in a meeting with you guys, the people that are paying the bills aren't there. We're not in that meeting, and so that's why we have to rely on you guys to sort of walk the fine line between the creative side and the fiscal responsible side. And it sounds like you got that off to a good start.
Yes, sir. I'll add also, there was one firm that said, the best idea here may be just to mow this one down and build another one. And we went, that's not going to happen. So don't bring that proposal back. And I'm not sure they even brought a proposal back. So we were, we have been, and I'll say this too. There were lots of comments about the physical structure and the cleanliness and the upkeep of the facilities as they were. So it was a pretty detailed visit.
Good. Thank you.
Yes, sir.
Okay, other questions for Dr. Buckwell? Well, I would just like to say I'm very excited that you're taking this direction. I know I was involved in some of those conversations about the old Cannon Gym, which has the date on that, I think, was 1930 something.
32.
Yeah, so that certainly has gotten a lot of use. And the historical significance of that campus, having served as a campus since J.W. Cannon High School was built on that property, and I don't know what that original date was, but it was probably in the 20s or 30s as well. And so I think that just certainly is a good approach to get some professionals in there. To give us advice on how we can best utilize that, and hopefully get another 7,500 years of use out of it as well.
Yes, sir. That's our goal.
Okay, sounds like that covers all the questions. We'll move on to the next item, which is very closely related to the age comments I just made.
Yes, sir. So we had a boiler go down last week at A.L. Brown, maybe the week before that at A.L. Brown. They have jerry-rigged it, I guess you could say. They fixed it the best they can. The motor in it that makes it function doesn't work any longer, so they had to replace that, but it's not replaced. It's at least 40 years old, and they think it's closer to 50 years old. And we're requesting $140,000 to replace that main boiler. We got that number from the boiler that was replaced at Central Cabarrus. So basically, we didn't have somebody come in here and give us an estimate on that. We just based it on the replacement from Central when we made this request. So that's a good ballpark number, we believe.
Okay, questions on that item, commissioners? All right, thank you very much, sir.
Thank you.
Okay, we will move now to item 3.6, new position for Juvenile Crime Prevention Council. And Rodney, yes, sir.
Was that the item that Rodney mentioned during the retreat that we might need to suspend the rules for?
Yes, it certainly is, and thank you for reminding me of that. I was breezing right on past it. That is an item that they need to pay attention to right away, and so they have requested that we suspend the rules and approve these two requests so these projects can begin. So at this time, I would entertain a motion to suspend the rules.
So moved.
Second.
Okay, I have a motion by Commissioner Honeycutt, a second by Commissioner KIGER. Is there any discussion? All in favor, please say aye.
Aye.
All opposed, please say no. That motion passes, and I would at this time entertain a motion to release $229,000 from contingency to be used for the A.L. Brown boiler replacement, master plan study, and to approve the budget amendment.
So moved.
Second.
Okay, motion by Commissioner Strang, a second by Commissioner SHUE. Is there any further discussion? Okay, hearing none, all in favor, please say aye.
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 All opposed, please say no. And that motion passes unanimously. Thank you, and thank you, Commissioner KIGER, for preventing me from going on too far. So now we'll go to item 3.6, a new position for Juvenile Crime Prevention Council, and Rodney Harris will talk with us about that one.
So this item is for the creation of a new part-time 9103 position, which means it would work less than 1,000 hours a year. And this position is necessary because the sheriff's office has a pending retirement at the end of June. And that individual that's been performing these duties for the Juvenile Crime Prevention Council, with their retirement, the sheriff needs to leverage that position for other needs, given the volume in some areas in the sheriff's office. So creating this position would add about 20 hours a week of support for the Juvenile Crime Prevention Council, and it would be paid for through those funds, up to $15,000.
Okay, Rodney, if I'm not mistaken, that's the way that's currently handled, but that funding is just going through the sheriff's department.
Correct.
Yes. So we're just shifting it from one department to the other. Any other questions, commissioners?
But it will require additional funding county side to fund the new position, or the deputy, or the sheriff's department. Correct, Rodney?
Correct. So the sheriff's office position will, rather than having $15,000 of revenue offsetting the expense, will become a county expense.
Okay, and that would be part of their budget request for the next fiscal year?
Correct.
Yeah.
Yeah.
Okay, any other questions, commissioners? All right, thank you very much. We move to item 3.7, requests for easements. I think Jonathan Marshall and Kyle Billifer will talk to us about those items.
These are actually two separate easements that are being requested, but because they are both stormwater easements for sand filtration systems, we grouped them together. One of these is located at the Operations Center on Cabarrus Avenue, a recently constructed sand filtration system we installed there. And then the other one is at J.M. Robinson High School and was necessary as we went through the turf field project. They had some additional impervious surface and had to install this because there was more drainage than the existing system could handle. So we just put these two together for your approval.
Thank you, Jonathan. Questions on that, commissioners? I'm sure that Jonathan will give us a lengthy lesson on the makeup of sand filtration systems if you would like to hear about that.
I think Mr. Billifer would love to have you come out to the Operations Center and he'll show you exactly how they work.
That might be a better idea. Our viewing audience might appreciate that better as well. Okay, any other questions?
That sounds like a future episode of Out and About.
Yeah, exactly.
And I know who will host it now.
Yeah, I think he just volunteered.
Yep.
Okay, thank you. We move now to item 3.8 from Department of Human Services, transportation grant funding. And we're happy to have Anthony Hodges and to talk about that one.
Excuse me. Good afternoon, commissioners. Thank you for allowing me to speak with you this afternoon. Yeah, with this budget amendment that we're requesting approval for, there's several funding changes on that. The first one is an addition. We received earlier this year a little bit over $586,000 in CARES funding for transportation. That funding doesn't require a county match, and we just asked that be added to that be approved. Also on this budget amendment, there's a couple of grants that were in our original budget for the year that we didn't receive. The first one's a 5307 grant. We were not approved for that grant, and so we asked that those funds be taken out, and also the expenditures for those funds. And also the road grants, the rural operating grants. The state this year decided not to approve any of the road grants for the state. So we asked that those funds be taken out also, and the budget amendment be approved.
Okay, so I think you actually covered in that both item 3.8 and 3.9. Is that correct?
Well, 3.9 is also a note. I can go over that one too. That one is we receive money for vaccination transportation through Department of Health and Human Services and the Northside Department of Transportation. We received a little bit over almost $33,000 to help provide transportation to individuals who need transportation to the vaccination clinics. So we have worked over the last few weeks with the Health Alliance and have set up kind of our process for that. We've done 2 or 3 trips out there so far, doing weekly trips and assisting people with transportation. So that's what that next agenda item is, sir.
Okay, so we have some CARES Act funding in both of those items. Is that correct?
Yes, sir. The first is CARES Act, and the second one, through Department of Health and Human Services funding. Yes, sir.
Okay. Commissioners, do you have questions on either of those two items for Anthony? And I think Bob Bushy is on the call as well, if you have questions for him.
That's good. Anthony, this is Lynn.
Yes,
I just
sir.
wanted to ask you, whenever you make application for the grants, the 25307s, and you don't get an approval, do they usually tell you what happened? The funding was that they was going to use lost, or something that we did on our end, or I mean, is it just? I'm just curious why we lost that funding.
Bob could probably give a better answer to that one. I know for the rope funding, it was just a statewide decision. The legislature didn't approve that for anyone this year, but for the 50 year 37 for those grants, I'm not sure if we get detailed information, but Bob may have a better answer.
If Bob's talking, he's muted, but
I apologize. I always do that. The 5307, we technically do not lose the money. It rolls over for up to 5 years. I think it was just a real competitive application process last time. We have actually applied for it again in the upcoming budget. I have not heard back whether it'll be approved or not.
That's great, Bob. Thank you, because that's a substantial amount, and, obviously I was just curious, but I appreciate your input and thanks for all you do.
Thank you.
okay, any other questions for Bob or Anthony? All right, thank you, gentlemen.
Thank you.
We move now to item 3.10, and this is from Finance, audit contract for fiscal year ending June 30th, 2021. And we are happy to have Wendy Hagler with us to talk about that one.
Good afternoon. Each year, the Local Government Commission requires us to get board approval for our annual audit contract. Last year, our audit services went out for bid, and Martin Starnes was chosen. And so this is the second year of that 3-year contract that we have with them. The total cost is $65,000 for this year.
Okay, questions on that one, commissioners? Okay, we'll move to item 3.11, EMS CARES Fund Grant Budget Amendment, and Wendy will talk about that one also.
All right, EMS received CARES funds April of last year, and they did not get those funds spent by the end of June 2020, so those funds fell into fund balance. So this budget amendment appropriates those CARES funds so they can spend it. The grant period was extended 6 months, so they can, they've identified places that they can spend the funds, and the budget amendment appropriates the fund balance and those expenditures so they can spend it by the end of June.
Okay, any questions on that one? Okay, and then Wendy has the next one as well. 3.12, North Carolina Education Lottery Payment Application.
Lottery proceeds in the amount of 2.3 were included in the FY21 Community Investment Fund budget to pay a portion of the debt service related to public school debt. Upon approval by the Cabarrus County Board of Education, Kannapolis City Board of Education, and Cabarrus County Board of Commissioners, 2 payment request applications will be submitted to the Department of Public Instruction. This budget amendment budgets those funds to in the appropriate fund.
Okay, and I think that total is $2.3 million, which is pretty consistent with what we've done over the past several years, what we've received from the lottery. Does anyone have questions on that item? Okay, then we'll move to the next item, 3.13, and that one is Wendy as well.
Right. On January 19th, 2021, the board approved the contract for Carolina Tree Care for $47,500. The budget amendment at that time just appropriated those funds in a capital project fund, but there's already expenditures in the general fund. So we just basically want to do a corrected budget amendment to transfer the money to the general fund and keep all those expenditures together.
Okay, commissioners, questions on that one? I will say that that work did occur this past week. So if you have not been by there and have an opportunity, it looks quite different, much improved. Okay, then we will move to item 3.14 from Infrastructure and Asset Management, budget amendment to fund design. Kyle Billifer will talk with us on that one.
Good evening. In order to proceed with the design of the emergency equipment warehouse in the Information Technology Services buildings out on the Ramden Court, which is the parcel right across the street from the new Operations Center, a budget amendment is needed in the Capital Project Fund. The requested action is a motion to adopt the budget amendment and approve the project ordinance, and those attachments are attached. And Wendy's also on the line in case there's any questions about that. And that was discussed at the retreat this weekend.
Okay, commissioners, any questions on that item? All right, thank you, sir. We'll move to item 3.15, Planning and Development, lease agreement for St. Stephen's Park property for cultivation. And Kelly Sifford is with us to talk about that one.
Thank you. So as you all know, we've been moving very fast with the park in acquisition and planning for it. One part of the park that we were planning for was the continued cultivation of approximately 138 acres for at a minimum of 5 years, but with the potential to extend out another 5 years. So we did issue a RFP for that. We got 5 proposals from great farmers in our community. We had the Soil and Water District evaluate those since they had more of an expertise in the area to determine which one fit best with our goals. We evaluated them based on best practices and what they intended to do with the property and how that would fit in with as we develop it. Barrier Farm was selected as to be recommended to you for cultivation of that property. And because we are on a very fast time schedule, and we will need to be able to get them out there in April to not lose a whole planting season, we needed to ask for you to suspend the rules and authorize the county manager to execute the lease agreement if you choose to approve it.
Okay, questions for Kelly on this item?
Just a quick question. Just a quick question. What kind of cultivation are they planning to do out there? What type of?
So they listed their activities, and it was, I believe, corn, and they do soybeans, corn, wheat, oats, rye, and barley. So they would work a rotation of those.
Okay.
Is the proposal.
Okay. And is all that produce and stuff, you know, items that they're going to pollute, are they staying local?
Probably. They do actually have a little business end of their operation where they sell it, but a lot of that's probably also feed for local farmers, and I don't think all of it may be local, but a good portion certainly will be.
Okay.
One of the advantages, Commissioner Strang, to the Barrier proposal is they operate their own grist mill.
Right.
And they also serve other customers from that grist mill. It's actually a self-serve honor system grist mill. So I think the Soil and Water Board was very impressed with that, and it's kind of a whole process. And they also do, of course, they have their own store out on Barrier Store Road, and sell items there that are also produced on the farm.
Mm-hmm. That's all I have. Thank you.
Mm-hmm. Any other questions? Okay, if there are no other questions, I would at this time entertain a motion to suspend the rules of procedure in order to take action on this.
So moved.
Okay, we had a motion by Commissioner Strang, a second by Commissioner KIGER to suspend the rules. Is there any discussion? All in favor, please say aye.
Aye.
All opposed, no. That motion passes, and I would at this time entertain a motion to approve the lease agreement between Cabarrus County and Barrier Farms and authorize the county manager to execute the agreement on behalf of Cabarrus County, subject to review or revisions by the county attorney.
So
Mr.
moved.
Chairman, I'll move for approval.
Okay, we'll say that motion from Commissioner SHUE, second from Commissioner STRANG. I've heard multiple ones there. So is there any discussion? Hearing none, all in favor, please say aye.
Aye.
All opposed, please say no. That motion passes. Thank you. We move now to item 3.16 from recycling and waste reduction, roll-off truck purchase. And we are happy to have Kevin Grant with us to talk about that item.
Yes, good afternoon, everyone. The Recycling and Waste Reduction Department is requesting the approval to purchase a 2022 Mack roll-off truck with hoist and tarp. White goods funds will be used, white goods received from the state will be used to pay for this truck. Now, just give everyone just what white goods are. So it's basically appliances such as refrigerators, washing machines, ovens, stoves, things like that. So when you purchase these appliances, you are paying a $3 disposal tax. And these funds are redistributed to counties to support white good collection and recycling. The roll-off truck is being purchased under the North Carolina DOT statewide term contract 70E, and it'll replace our 2012 roll-off truck that has approximately 220,000 miles on it. Also, what we're presenting this evening is the budget amendment to cover the cost of this truck. So if there's any questions, we could take that, and we also have finance available as well.
Okay, questions for Kevin. Kevin, how many roll-off trucks do we operate? I mean, there must be quite a few.
We have, well, with this one, we'll have 4, which will put us at a much more comfortable level. We have a couple that haul recycling and then regular trash that we receive at the construction demolition landfill, residential waste that we take to the Speedway landfill. We take regular household recycling to the material recovery facility down in Charlotte. And a lot of this white goods and scrap metal goes down to foils recycling.
Yeah, I just recall that we've had roll-off truck discussions several times over the past couple years, so that's just the normal replacement cycle, I would imagine.
That is correct. And with this one, we'll get up to date where we'll have 2 fairly new, reliable ones that we'll feel comfortable with operating.
Great, thank you. Any other questions for Kevin?
Not a question, Mr. Chairman. I just wanted to add, with the white good fund in particular, using it for this purpose will help us to get more state revenue in. Because we have a fund balance right now, we have not been receiving an allocation here locally. So this will help us in that regard.
Okay, very good. Even better. Okay, thank you. We'll move now to item 3.17, UV light disinfecting system. And we are happy to have Chief Deputy James Bailey from the Sheriff's Office to talk about that item. And if Chief Deputy Bailey is talking, he must be muted.
Yep, I'm working remotely today from Camp Spencer. We're having our lieutenant's retreat to talk about the budget, to talk about operational issues, and that's about to wrap up. So I stepped outside. This item that's on for this evening is a UV disinfecting system. Now, the unique part about this disinfecting system that we're asking for is that this disinfecting system not only will disinfect small areas, but quite large areas, basically about the size of an office, maybe a little bit larger of our standard office. This is to help us with disinfecting areas because court will be resuming here in the next couple of weeks. We're going to have inmates that are being brought for video court proceedings. And just anywhere where we have inmates congregate, this system will allow us to disinfect the area using UV light, which I found through this process is used to help kill COVID, along with other viruses and bacteria. So the request came in from the jail. We looked at the system. It seems like it's a good system for us to use. So we're requesting that additional funding to purchase that equipment for the detention center.
Okay, questions for Deputy Bailey?
Chief, this is Lynn. Is just one unit, or are you getting multiple units?
I believe this system is a dual unit, so it's two units that work together to do those areas.
Just a quick question. You and I have already spoke on this before because I had a couple questions that I forgot to ask. The 3-year service contract, is that something that we need to renew every 3 years?
Well, yes, in essence, it would need to be renewed every 3 years. And I did find out that that service plan basically covers any normal wear and tear that the equipment goes through. If you have a burnout bulb, if you have something that breaks on it, they will come out and service it as well as doing any kind of upgrades to it. But it's just to cover standard wear and tear, so that we're not having to constantly go in and start replacing bulbs and that kind of thing.
Okay.
Yep.
Okay, any other questions for Deputy Bailey?
Just a real quick one. Is this something that if you see that it works very well, that maybe you're going to want to expand sometime in the future? I mean, just as we read through the literature or whatnot, it looks like, I mean, it's very intriguing on how it's going to work.
Well, yeah, I mean, it can be used. I know they use it in healthcare facilities as well as confinement facilities. So, obviously, it's hard to measure exactly how much of a virus remains in a room after you use it. But from the studies that we've seen, from the information that we've received, it's quite effective. So it could really be used in any kind of a business setting. So, for example, if we find that it's working very well, and it seems to be working, you could use it literally at the governmental center. You could use it really anywhere. From my understanding of this system, it not only works on a large area, but it's also quite quick. So I think within an hour, you could disinfect a rather large area using this system.
Very good. Yeah, I mean, that I guess that's what instinctively it just looks like there might be something there that may be well worth the time to use, especially you guys do a lot of training and had, I think pre-COVID, you do a lot of exercises where there's a lot of people in around either in your training areas or the upstairs, the meeting room. I'm drawing a blank on what floor that is, but so anyway, I was just curious.
Yeah, the technology, I mean, again, COVID's made us change a lot of the ways that we operate. We're finding ways to disinfect. I mean, quite frankly, I didn't know UV was such a good disinfectant until started doing some research and got this from the jail. In some of my conversations, our PPE prices, the cost of nitrile gloves, for example, has gone up. The cost of disinfecting solution has gone up. And quite frankly, when you're in a jail facility, you don't want to be using poisonous or any kind of dangerous liquids if you can help it. And certainly this system allows us to disinfect areas safely. The risk to inmates and staff using harsh chemicals is reduced. So we think it's definitely a good test case for the jail. And we can hopefully see if it works well, certainly use it in other areas of the county as well.
Right. Thank you.
Okay.
Yeah, I do, Mr. Chairman. This is probably for Rodney or for County Manager Downs. Since this particular expense that we're talking about is going to be COVID related, can we use some of the CARES money for that, Rodney? You said we had around $750,000 that would still be available out of the million after we get through with the Health Alliance. And so I'm thinking that maybe this might be something we could use some of that money for as well.
Yes, sir. So that's the plan for this one, is to use those CRF funds for this purpose.
All right, sounds good. Thank you.
Okay, additional questions? All right, thank you, Chief Deputy, and we appreciate that very scenic view of Camp Spencer as well. We're proud of that park.
It's been wonderful. I actually hadn't been in here in a couple of years, and the particular shelter that we're in, Helms Hall, is fantastic. It's really nice.
Great, thank you, sir.
Thank you.
Okay, now we move to discussion items that require no action. We are very pleased to have with us today Paula Yost to present our 2020 Child Protection and Fatality Team Report. Welcome, Paula.
Hi, Steve. Thank you so much. Hello, commissioners. Lauren has a copy of my presentation, so while she is getting that up on the screen to share it with you so that you can see it, I'm going to start off by giving you the standard disclaimers that I give you every year. The first one is that unfortunately I am going to be covering some very disturbing content tonight on child fatality and child sex abuse. Stay with me. It is difficult to hear. It is, however, important for you to hear. And so I just want to say that ahead of time, that we are going to be doing that tonight. The other thing that I wanted to add is that, and I say this every year, but I cannot say this enough, this presentation is not my personal opinion. Every year I work with the child protection team for our community, which consists of approximately 40 professionals. I'll talk more about who they are in a few moments. But I work with them every year to ask them, what do we want the commissioners to know this year? What is our topic going to be? They help me figure that out. They give me the direction. And then I present it to them every February before I present it to you. So they hear it first, they vet it, they correct me, they give me different things to say. So certainly this is a collective group from your child protection and welfare experts. So that being said, I recognize that it is 2021, but this is our 2020 report. So this is what happened last year. And so Lauren, you can hit the slide for me. So first of all, I know we have a new commissioner this year. This is the first time I've ever presented to Commissioner Strang. So largely for her benefit and just as a refresher for the rest of you, CPFT stands for Child Protection and Fatality Team. Some counties have this split. So in some counties, there is just a child fatality team, which is housed at the Health Alliance, and a protection team, which is kind of housed in DHS. For our county, it makes the most sense that we combine them both because it was all the same people appearing at both meetings. So we have a combined county here, which many counties in the state do that. It's up to your county what you want to do. What our focus is to examine the deaths of the children who passed away in the county during the previous calendar year. So for tonight, what we're going to be talking about is the children who died in this community during 2019. We discuss each case and we try to decide if there was any way that the fatalities could have been prevented. And we also look globally at issues that impact children in methods of seeking to protect them. We are mandated by a state statute. Every county in the state is required to have a child protection and fatality team. And the state statute states that we are to be an interdisciplinary group of community representatives who meet regularly to promote a community-wide approach to the problem of child abuse and neglect. I'm very proud of our team. As I stated earlier, we have approximately 40 members who attend regularly. We have representatives from Cabarrus Health Alliance, DJJ, the District Attorney's Office, the hospital, the Cabarrus Partnership for Children, the school system, EMS. There's almost no agency in the county that I'm aware of that has any involvement with children that does not participate regularly in our team. So Lauren, next up. So these are our 2019 child deaths. The good news about this, while certainly we don't want there to be any child fatality, but the good news is that our average is sticking to the average. So in 2019, we had approximately 23 children who passed away. And if you look beside that, that shows you the numbers of children that we've reviewed in recent years. So usually somewhere around 23 is about our average. 5 of those fatalities, 5 of those 23 were due to illness, and those were illnesses that could not have been prevented no matter what. So cerebral palsy, malignant neoplasm of the brain, those are examples. These are things that there is nothing that anyone could have done that would have helped those children survive. We had 9 cases of prematurity. When we say prematurity, we're talking about extreme prematurity. As a general rule, these are children that were delivered somewhere before 25 weeks of gestation, and there can be any number of reasons for that. Sometimes it's preeclampsia, sometimes the mother has an incompetent cervix. There's a laundry list of reasons why this happens. But usually when a child is born prior to 25 weeks, some 23 and 24 weekers can survive, but it's rare. And those children have a long road to hoe, basically. But those are usually our children who there's absolutely nothing that could have been done to prevent those fatalities. The next up, we had 8 children who died from accidents. When we talk about accidents, the ones in that concern us the most are those top 3, because the top 3 are unsafe sleep. And so we've had issues of unsafe sleep. It is a national problem. It's not just Cabarrus County. It is all across the nation. I will tell you that I think our county does the best job we possibly could on educating parents on the dangers of unsafe sleep. Having personally given birth at Cabarrus or at Atrium Cabarrus within the last 3 years, I can tell you that the labor and delivery nurses spoke to me extensively about what co-sleeping is. They do that with every mother who gives birth there. There's even a video that they show you that talks about unsafe sleep. Pediatricians hammer this in. I don't know a pediatrician in Cabarrus County who doesn't speak extensively to mothers and fathers about the dangers of unsafe sleep. Nevertheless, despite that education, we still have, honestly, we have 1 unsafe sleep fatality per quarter in Cabarrus County. That's pretty much been our norm ever since I started chairing this team, and I've been doing this for the last 7 years. So I think we're doing everything we can do. I would be more concerned if that number was higher, but I would like to not see any of those if that was an option. We did have 2 children who died in a car crash. We had 1 mother who tragically injured her child while she was suffering a seizure. We had 1 assault by a handgun. The assault by a handgun actually happened in Mecklenburg County. And then we also had a drowning. So we also have 1 case that's pending DA's review. So anytime we have a case that's pending DA's review, it's not going to be shown up here. So if you guys would like to turn the page, or Lauren, if you'd like to click. This is what we're going to really focus our topic on this year, which is how the pandemic has impacted our children. And so I'm going to talk to you about child abuse reports and the quality of reports, sexual abuse concerns, the fact that obesity rates are up, mental health concerns, and then also our concerns about unsupervised juveniles, which have increased our DJJ numbers. Next up. Real quick, Karen Calhoun is also on the line, which I very much appreciate. And so, Karen, if at any point while I'm speaking about DHS numbers, if you want to jump in here, I welcome you to do that. So first up, investigations. So investigations are the number of phone calls that came in to Cabarrus County DHS. They worked with 3,728 children. For Cabarrus County, they accepted 1,483 cases, and out of those, 412 are forensic cases. A forensic case is what we would consider child physical or sexual abuse. Forensics make up 27.8% of the cases that were accepted in Cabarrus County. Out of the total amount of cases, 261 of them had substance abuse allegations, And out of those 80 cases, or 31%, alleged opiate use. Out of the total amount of cases accepted, 72 were screened for DV. But this does not include those cases that were screened for injurious environment or discord in the home. Both DHS and the District Attorney's Office have reported that they do feel there is, it looks like there's a decline in DV reports, but that doesn't mean there's less domestic violence. What it means is that domestic violence victims really don't have anywhere to go right now, or they have less opportunities for somewhere to go. So we think that they're reporting and calling in less, but that doesn't mean that DV is down. It just means that people feel like they're stuck because where are they going to flee to? So we're seeing less of that. Karen, do you have anything you want to jump in here with real quick?
Sure. Let me get my camera on too. One of the indicators that kind of stands out in some of these statistics is one of the indicators with the substance abuse that's indicated. There's a kind of an anomaly with some of this data, trying to figure out, you know, why did some things go up and when some things go down? There's a pretty substantial increase in the number of children actually served, which means those are reports coming in, the 3,728 cases. That's the number of reports called into our intake investigations for child abuse, neglect, or dependency reporting. And I think you've got a slide coming up, Paula, that has some comparable numbers to 2019. Mm-hmm. And so that part is good news to us in that across the board with other counties, we have heard of a significant decline, particularly in March, April, and May of last year, where the pandemic hit and those reporting numbers went down significantly. So for us, that did not happen. So that's one thing that I think is important to note. And then with regard to the substance abuse, that could be an indicator of hidden issues that with families being cooped up more, and we're not getting the quality of the report. So as Paula goes through this, I'll chime in if she gives me an opportunity, but it's kind of interesting to look at the data from one year to the next and do the comparison with the COVID and pandemic that happened and how it has an impact on our reporting. Thank you, Paula.
Sure. Okay, Lauren, you can move the slide on along for me. So also, this is a little bit of an update. So in 2020, we had 8 families in prevention as opposed to 6 the year before. That seems like a low number. Probably the reason that number is low is because families have to voluntarily participate in prevention. Prevention is also a relatively new program for Cabarrus County, but I think it's a very, very important one. Because if a family does well in prevention, then they're likely going to avoid needing escalated services, which could cause their children to be removed from their home. 62 families per month were in in-home services as opposed to 2019's 54. When we talk about in-home services, these are children who are not ripe for foster care. So most of them are children who are just living in poverty. You know, it's not a crime to live in a minivan. It's not a crime to live in a tent. Poverty is not in and of itself alone something that will cause your children to be removed from your custody and your care. So a lot of our children wind up in in-home services who are just poverty stricken. But we also had 152 children in foster care per month as opposed to the previous year's 133. Right, next up. So these are also our comparison numbers for you guys. So, and this is again where Karen can possibly be very valuable. So if you look at our 2019 numbers for the number of children that were served versus our 2020 numbers, you do see an increase of approximately 500 kids from 19 into 20. And then but you also see a decrease, not a substantial decrease, but you do see a decrease in the cases that were accepted for forensic. One of the potential reasons for this is also that typically children are in school. So when children go to school, they report child abuse and neglect to teachers, to school nurses, or teachers or school nurses just observe something that's concerning to them and causes them to speak to the child. DSS is used to actually interviewing children at Cabarrus County schools. Right now, the children aren't in schools. In fact, they're almost always at home in their house with a potential perpetrator. So social workers are now having to interview children in their home environment. So you can imagine that you're not going to get a child who's terrified to tell you if there's abuse or neglect happening when they're in the house with a potential perpetrator. Karen, if I need that, if I didn't state that cleanly, please jump in, because I think that's so important and I don't want to be incorrect in the way I mentioned that.
That was exactly spot on. Okay,
good. Thank you. Also, we see that the number of cases that got screened in for substance use and opioids are actually up 6%. Domestic violence cases are up just a little bit, but then the number of assists for other counties and other states is actually down. And Karen, if you want to discuss that real quick.
Yeah, as far as the indicator with the reduction in cases that are actually coming in from other counties, I believe that is indicative to what we've seen across bordering counties, where that decline in the number of reports actually coming in overall declined in other places. And I think that's attributable to the very nature of our county and our community spirit, where we know how to make reports and we reach out if there's a concern, even if we're not sure, and they know how to find us, and they're responsive, and they know we're going to be responsive. And I think that is why our overall reporting didn't go down as far as the number of children overall being reported on and served. But when you look at the screen-ins and a request for an assist from another county, those have declined, and I think that's indicative of where they have seen, particularly in March, April, and May, a decline in reporting overall, and that has happened across the state. And it's been concerning at the state level with the meetings with the Directors Association and others, because of the safety of children and not being seen quite often because they're not in school or in daycare, childcare facilities as often. So I think that's part of what you're seeing there when you look at those numbers.
Thanks, Karen. All right, we can move the slide here. Okay, so these numbers right here, this is important, and this concerns me and it concerns my team a good deal. So if you will look at the 2019 numbers, we had 300 children who were seen at the Jeff Gordon Children's Advocacy Center. For those of you who are not familiar with the Children's Advocacy Center, also known as the CAC, that is where we send children when they have been physically or sexually abused. So that is where we are able to perform rape kits on children if that needs to be conducted. And that does happen in the county. That is the reality. It happens nationwide. So in 2019, we had 300 total children who got seen in the CAC. And then I have a breakdown for you under there of, male to female, and then the ages of those children. But then if you look over to 2020, our numbers dropped by over 100 children. That does not mean that child abuse is not still happening. It just means that we are not being able to catch a lot of those. And so some of the reasons for that, it kind of goes back to the things we talked about before. So it goes back to when we get reports typically were coming from the school system. And so we were able to investigate with children in school, whereas we can't really do that now when they're in the house with the perpetrators and get the same result. Another reason for the decline, which isn't a scary reason, is that if you are between the ages of 0 and 2, so any child that is a 0 to 2-year-old, those children are now being seen at Levine's. So they are going straight to Uptown in order to be treated. So we're not seeing those at Atrium Cabarrus right now. We used to see those kids at Atrium Cabarrus. I suspect we may resume seeing them here once the pandemic ends. But for right now, Atrium just made the administrative decision that those children were going to go to Levine's. But even with that, if you look at our numbers, that still doesn't really account for, a 100 child difference. I'm going to speak about this a little bit later, but what we're seeing, and this is comments that I'm repeating from the DA's office, the court system, and from DHS, is that we are still seeing child abuse. But in the past, we would catch child abuse fairly quickly because, again, the children were going to school. Now with the children not going to school, we're still catching it but the number one reporter right now is law enforcement. And so you can imagine what it takes for law enforcement to get involved. What's happening is we're having kids that once upon a time would have had some bruising or some scraping that was concerning, and now they're having broken arms and legs. And so we're seeing children that are badly, badly injured. And that is part of the 193 that we have. Karen, do you have anything else you want to add to that? Okay. All right. Next slide.
I apologize, my computer is frozen.
You're fine, Lauren. Okay, so next up, I actually modified this slide from the time that you guys are seeing it right here. So in Cabarrus County, we have had a 46% increase in human trafficking referrals from our human trafficking agent. And Mecklenburg County has only had a 32% increase. Not that any increase is good, but we are higher than Mecklenburg right now. And it's important to recognize that human trafficking is not just a metropolitan problem. This is something that happens everywhere. It happens here. I'm aware of a child whose family I personally know who's missing right now and who is a potential human trafficking victim. So I want to just talk about this for a second, because this is one of the really bad ramifications of the pandemic. We already had some concerns about human trafficking in juveniles, but this pandemic basically poured gasoline on those concerns. So online sex abuse has spiked by 31% in 2020, with at least 13 million disturbing images on Facebook and Instagram between July and September alone. Coronavirus lockdowns and live streamed abuse have fueled that increase. Facebook actively scans for child abuse pictures, but other entities don't. And most content is actually made by a child's caregiver. So in the United States, tighter legislation is needed to compel platforms to proactively detect and remove child sex abuse images. There is currently a bill in Congress that was brought by Representative Lindsey Graham of South Carolina, which is called the Earn It Act, which would basically allow websites to be sued if they are allowing child pornography to be released onto the internet. But essentially, this pandemic created a perfect storm, because we already had, human trafficking's kind of gateway scenario was unsupervised juveniles who are on the internet, chat rooms. And so now juveniles are on the internet all day because that's how they're doing school. And so it's just created so much more of a window and so much more of an opportunity. So it's very, very important that parents are vigilant about this. And that they know human trafficking is a concern. Also, again, when kids are in school, every teacher in Cabarrus County, for the most part, that I'm aware of, has been trained on human trafficking. They get training classes on that as part of their job. And so the teachers know what red flags are, SROs know what red flags are, but the average Cabarrus County resident may not. So a lot of people just don't know the red flags that are there at the moment. Next slide. This is our county's homelessness dashboard. So this looks really small on the screen, but what's important is the top right little column, which is in orange. So during 2019, during the 2021 school year, Cabarrus County Schools and Kannapolis City Schools were aware of a combined total of 471 homeless children. In 2021, so where we are right now, we've only been able to identify 160 students in Cabarrus County and 32 in Kannapolis. So that is a significant decline. So in speaking with our local experts about what has caused this decline in homelessness, we think that the school system, we still think, is doing a great job of identifying children. So if kids aren't signing into the internet and they're not signing in and doing their schoolwork, the school social workers, which are chaired by John Basilise and Amy Jewell, are doing a great job of identifying these children and working with them and their families. So DSS has been aware of that. That hasn't been a huge concern. What has been a huge issue, though, is that evictions are not happening in the county. So there's a moratorium on evictions. So last March, evictions stopped, But prior to that, the county did approximately 300 evictions per week. And so we're expecting the number of evictions to go up, which means that the number of children are going to go up as soon as that moratorium is lifted. I am aware, though, that, and Karen can probably jump in here and talk about this, there is some grant funding that DHS has that will hopefully help some of those families to help prevent evictions. Karen, do you want to?
Yeah. We actually have a presentation coming up next that will talk about the Emergency Rental Assistance Program. And so, yes, we will be discussing that.
Excellent.
Question real quick, like Paula, did you say 300 convictions a week?
Evictions. I may have misspoken. It may have been a month. Actually, Karen, do you remember what that number was? I can't remember right now if it's 300 a week or 300 a month. It might be 300 a month.
For a 10-year trend, it was 100 a month. And then when we got into the summer months, right in the middle of COVID, it increased and was an anticipated increase to 300 a month.
Okay, so 300 a month is what we are anticipating it to be after COVID.
Okay, thank you.
Okay, no, thank you. That's important. I don't want to inflate the number. All right, next slide. Okay, so this is actually an old slide because we do not have updated contact numbers right now on obesity for 2020. So I cannot tell you right now how much obesity has increased for Cabarrus County children versus where it was in 19. So Jessica Castrodale has some excellent data from 19, but I don't have 2020 data that I can compare that data to right now. I can only tell you anecdotally what I'm hearing from the pediatricians who serve on our team and from other pediatricians across the county. And what I'm hearing is that they are calling it the COVID 30. They said that we are seeing numerous juveniles who are in their home, they are on the computer all day, they are eating processed foods, they are not having the opportunities to do things for physical activity or to play sports that they were able to do before, and that they are seeing children with cholesterol, diabetes, and even non-alcohol related liver disease. So that is deeply concerning. I don't know that we have the resources to deal with a bunch of children who have diabetes as a result of obesity in the coming months and years. So obesity is something that I think as a community we're really going to need to work on when it comes to kids as soon as we possibly can. But again, I don't have data for that right now. I just anecdotally, that's what I'm hearing, but we should know that more soon. And I'm really hoping that CHA and Atrium will be all over that. Next up. So this right here is the child visits to the emergency department in 2020 for Medicaid only. And after I talk about this, I want to talk to you about overall. But for just Medicaid kids, so these are just our children who were in foster care or were low income and have Medicaid. The average length of a stay was 2.4 days in the emergency room. There were 85 distinct children for a total of 110 visits. So what that means is that when it says 110 visits, it was 110 individual visits to the emergency room with 85 children. So some children went more than once. The average breakdown for children between the ages of 5 and 10, there were 16 kids. For children between 11 and 13, there were 40 kids. And for children 14 to 17, there were 54 kids. One 17-year-old was in the emergency room for 23 days, one 16-year-old for 21 days, one 13-year-old for 8, and one 9-year-old for 5 days. And also, and this was something I clarified repeatedly with my team and with Cardinal Innovations. So I got these numbers directly from Cardinal. And what I can tell you is that this is not physical injury. This is not like the common cold. These are children who are a danger to themselves or others. Next up.
Paula, I have a quick question.
Yes.
This is Blake, and maybe this is maybe this is obvious to everybody else, but so when you say in the previous slide that somebody stated, I'm sorry?
Oh, you're good, Blake. Go ahead.
Okay. So when you say a 17-year-old was there for 23 days, so emergency rooms have emergency beds. They don't have beds for days and days and days. So do you mean they were checked into the hospital and then stayed for 23 days? Is that what that means?
I wish that was what it means, but no, not traditionally. So, Blake, what you just asked highlights a national crisis that not enough people know about. So as a general rule, you're right, emergency rooms are for emergencies. But the problem that we have nationwide, and certainly in North Carolina, is that we do not have enough psychiatric unit beds for juveniles. So because we don't have enough psychiatric beds for juveniles, what happens with those kids is that they stay in the ED until a bed is available because there's nowhere else to put them. So if you have a 17-year-old who the psychiatric evaluators in the emergency room truly believes is a danger to themselves or others, they hold them there until a bed comes open for them. And so sometimes I've seen children actually sit in the ED for far longer than that. So, I mean, I actually think 23 is not an egregious amount of time for a child to sit in the ED if they're truly that sick. It is a horrible situation for those children because it basically makes them feel like no one loves them, no one cares about them. They wish they'd never told anyone anything was wrong with them in the first place. That is something we hear over and over again. And that's not just Cabarrus County. This is a national crisis.
Okay, well, thank you for clarifying that because I had no idea that that was the case.
Yeah, and actually, Lauren, you can stay right here because I got some additional information, but I don't have a slide for it. So overall mental health visits to the emergency room for 2020, so remember, these are the Cardinal only. So this is only Cardinal Innovations with Medicaid and ED. When you add on private insurance, we had 353 children who were a danger to themselves or others in 2020. So that means we had almost a child every single day of the week reporting to an Atrium Cabarrus emergency room because they were a danger to themselves or others. Under that, the average length of stay was 2.5 days. The average age was 14 years old. The youngest child was 5. And of that 353 children, 189 kids were moved to a psychiatric hospital for longer-term treatment. So that means that roughly half of the kids who presented were suffering from a significant enough of a psychiatric concern that they were moved to a more extensive stay. I also had the hospital pull the exact same data for 2019. In 2019, we had 324 admissions, but we only had 145 children that went for a long-term psych stay. So you're looking at a pretty significant increase with the number of kids, not so much the number of kids that reported to the hospital, but with the number of kids who needed to go for a long-term intensive psychiatric stay.
Paul, a quick question on the psychiatric stay. Where's the closest facility to us and how are those facilities holding up with all this uptick in psychiatric admissions?
That's an excellent question. So the two closest facilities to us are Billingsley. So it's also called Atrium. It used to be called Atrium Randolph, but it's literally on Randolph or on Billingsley in Charlotte. So they have a juvenile unit. There is also one at Presbyterian Hospital, but you have to remember that those units are small. Like you're talking like maybe 18 beds per unit, and you've got every child in Mecklenburg County trying to get into those beds. We also have parents here whose kids are repeaters who have had to go to the ED here before, who they've been through this already. So they just take their kids right to Presby or Billingsley now in hopes that they can get them in. There are a number of facilities out at the beach. There's a few in the mountains, but there just simply are not enough units for juveniles all across the state. And this is a problem that it doesn't appear to be getting any better. This is a conversation we have with elected officials all the time. And it's certainly one that in an ideal world, we would build. I mean, I would love to have a facility in every county, but that just doesn't seem to be where we're going, unfortunately.
Is that a result? is that like translate into, you've got a 17-year-old that's been in ED for 23 days. Is that a result of not being able to be placed in a psychiatric facility?
That's correct.
Okay.
That's a child who needs to go to a psychiatric facility, but there is not a bed available for them to go to. So Billingsley's full, Presbyterian's full, the beach is full. So there's just not an option for them at this time. I will also add to that too. Some of the time when we see a child that's in a stay that's that long, not all the time, but some of the time that child is a juvenile sex offender. And so they're what we would classify as danger to others. Yeah. So if you're a juvenile sex offender, it's much more difficult for you to get into one of the other units because you can't go to some of our other psychiatric units for children who are suffering from danger to self if you're a danger to others, particularly if they believe that you are a sex offender because you've already got pending criminal charges. Okay. So if that is the case, those children have even less resources, and many of those children wind up getting placed outside the state as well. So those children are in a different group. So we definitely do. Some of those length of stays are for reasons like that. There are extenuating circumstances, but sometimes it's just bad luck. I mean, sometimes a kid just goes in there and they really need to go somewhere for more intensive therapy, and there's just not a bed available for them.
Mm-hmm. Mm-hmm. Thank you.
Sure.
Paula, this is Lynn again. I hate to delay your presentation, but I was just noticing that on this, the child visits to the ED in 2020, these that we're talking about are Medicaid recipients only.
So what's on the screen is Medicaid recipients only, but after I made this, I followed up with Atrium. And so Atrium was able to give me the total number, which includes Medicaid and private insured. Okay. Well, so if you add the private insured onto it, it was $353 for 2020.
Okay, that's what I wanted clarification on. Thank you.
Sure.
And Paula, I hate to interrupt you, but just for the benefit of the board, some of the conversations that we have had in the past and hopefully we will have in the future have surrounded potential opportunities to improve this problem. That was the subject of the field trip that several of us, along with representatives from the Health Alliance and Atrium, made to Guilford County last year. I think I've probably had some discussion about that with all of you to look at potential solution. Well, it's not really a solution, but potential avenues that we can explore to provide better services for these children. So I'm sure that we're going to have opportunities to talk about that more in depth during the next year. Thank you, Paula.
Sure. Okay, Lauren, I think I'm ready for my next slide. So I also want to talk to you guys about what's going on in DJJ. So DJJ is Department of Juvenile Justice. And what we're seeing there is we are seeing a tremendous increase on the docket there for felonies. So in the past, it's not that we didn't have felonies, we did, but we had a lot of misdemeanors sprinkled in there too. Now 85 to 90% of the offenses on the DJJ court docket are felonies. That is a drastic increase from what we've seen in the past. A few other things. Most crimes are happening during the day when children would normally be in school. Also, and this is probably one of the more important points I'd like to make to the general public tonight, we are seeing juveniles who are breaking into cars and stealing guns. Please be responsible gun owners. Please do not leave your gun in your car during the day. You know, take your gun, get your concealed carry, take your gun, put it in a gun purse, come up with something. But juveniles are stealing guns from parked cars during the daytime. And this is deeply concerning to us because, you know, one concern that we have too is that some kid is going to break into someone's house or some car and they're going to pick the wrong person and they're going to wind up getting shot. And so Our hope is that as the children get back into either school or some form of alternative programming, that some of these numbers will go back down. We are seeing some kids who are coming down from Mecklenburg County who are engaging in these crimes. And certainly if any of you are asking yourselves, well, what are these juveniles doing with these guns? We are also asking ourselves that, and we are very concerned about it. We don't know whether the juveniles are keeping the guns to use it themselves. We don't know if they are selling them. We don't know if they are involved in Mecklenburg County gangs. There's really no answer to that for sure, I don't guess. But we are seeing a dramatic increase in firearm theft from vehicles. So do not leave your gun in your car outside of your house or anywhere else. We are seeing them get stolen. Please be responsible with your weapons. I think that's all I have. You know, traditionally at this point, and I said this to my team, you know, in years past, I usually try to close this presentation with something positive or something good that I have to say. And I really don't have that this year. I wish I did. I genuinely don't. This pandemic has basically poured gasoline on all the problems we already had for our children. And it's something that I'm deeply concerned about. It's also something that our team is deeply concerned about. I'm very much hoping that as vaccines roll out and that as families kind of get their lives back to normal, that we will see all of these numbers kind of self-correct on their own. But how that's going to go probably really remains to be seen. So I do think that from your perspective, it's important for you to know that we are seeing these increases in obesity, in crime, in you know, the lack of quality reports that we have in DJJ and the CAC, an increase in mental health concerns that we're also seeing. Not that it's necessarily the role of the commission to do anything about those things, but it's important that you're aware that they are happening and they are a concern as other community members present funding opportunities to you and potential options. We're really hoping that this just kind of self-corrects. I'm happy to answer any questions that any of you have.
Not really a question, more of a comment. Yes, these are very alarming numbers and very concerning. Will you be providing an update as schools get back into session and they're there for a little bit? Can you provide us with an update of, has the reporting leveled off? Are you seeing an uptick in reporting? Anything that would help us going forward understand? I mean, clearly COVID has definitely, like you said, put gasoline on the situation. I'd like to circle back and see where we stand, you know, say 3 months down the road when schools hopefully are back under Plan A, just for our knowledge, you know, and see where we're heading and see if there's something we need, you know, need to maybe look at a little bit sooner.
I'd be happy to do that. So that would put us somewhere in probably actually when the school year ends, which would probably be in June. But I'd be happy to give you an update then, and then I could probably give you an update around like mid-October and let you know how things look at that point as well. Let the kids get back to school in the fall. I'm hoping they get to go back to school in a normal environment next year, knock on wood. And so I'll make myself a note to do that for you as well.
Thank you.
Okay, any other questions for Paula? Thank you so much, Paula, for that report. It is not information that we particularly enjoy hearing, but it's information that we need to hear and we need to be aware of. And we certainly appreciate your dedication in all the time and energy that you volunteer to lead this team, as well as all the other members that are involved in that process. The thing that strikes me is how rapidly the years, it seems like you were just here a month or two ago giving your annual report. So that just is an indication of how quickly time passes and the tremendous impact that it has on children in Cabarrus County. And some of these situations that you're talking about are certainly an immediate concern, but the inactivity to address those issues and those problems turn into very long-term problems for these children as they become adults, as well as for our community as a whole, our law enforcement. It is a snowball effect if we do not address these issues and take action early. So with your guidance and assistance, hopefully we can make some strides in that direction over the next months. Just one last opportunity for any questions before we move on, commissioners. Thank you, Paula. We appreciate you being with us.
Thank you.
Okay, we move now to item 4.2 from Infrastructure and Asset Management. Request from Oakboro Police Department to provide fleet maintenance services. And we have Michael Miller and Kyle Billifer to talk with us about that item.
Good evening, Commissioners. The Town of Oakboro Police Department has requested the county to provide routine fleet maintenance services and new vehicle setups for the department. Their department currently has 11 vehicles in their fleet, and they're utilizing local shops for fleet services. According to the officers that we spoke to, this has become costly for the town. They also use a local shop there to set up their new vehicles, but the person who ran that shop's taken a job elsewhere. And apparently there's an officer in Oakboro who is a former Cabarrus deputy and spoke favorably of the county maintenance garage. So the town has requested that the county provide these services. This would require an interlocal agreement between Cabarrus County and the Town of Oakboro Police Department. And Kyle Billifer, the area manager of operations, is currently working on with legal counsel on a draft agreement. If an agreement is reached, the county would bill a flat labor rate for services, and we're currently working to establish that rate now. Parts would be from the county inventory and would not be marked up. They would be billed to Oakboro at cost, just as they are to other departments now. All new equipment for the patrol cars would be purchased by the police department, Oakboro Police Department, and delivered to the county for installation. We've already met with our county finance department, and they've indicated that there's no problem with the financial piece of this. And so our goal today is to receive input from the board as to whether or not you would like us to pursue setting up this agreement. And if you do, would you like us to bring it back to you before implementation, or are you okay with us proceeding with legal approval and approval from the county manager? So that being said, I'll try to answer any questions you guys have.
I'm okay with the second choice that you said of moving ahead. Myself, I think it's good when we can work well with our municipalities and help where possible.
Yeah, I think the obvious question is somebody has analyzed and we've got the capacity to provide the labor.
Yes, sir, we do.
Okay, yes. I mean, what you outlined, I'm totally fine with, and honestly, I don't, in my opinion, does not need to come back to the board. If it goes to Mike and Mike signs off on it, that's fine with me. If we've got the capacity to do the work.
Michael, this is Lynn. I'm good with everything that you brought to us. However, I do have a concern though about as far as the parts and things that you guys will sell them at our cost from our parts room. And that's no problem. That is no problem. But where I see a potential problem, and most shops won't do this, and is if you bring your own part in there, they won't install it. And so when we are going to be getting parts that's going to be brought to us by the Oakboro Police Department, is it going to be specifically spelled out that it has to be a new item? Or why can't we just run that through our parts department as well, just and not mark it up? But I just don't want to see us get in a situation where they might bring us a good used this or a good used that and want us to put it in. And then for whatever reason, it don't work. And then, we get ourselves in a mess because we just put in what they brought. Whereas if we would go ahead and just order the part through our parts department with no markup and do it that way. That's just my thoughts on that.
Commissioner SHUE, this is Kyle Billifer. That'll be laid out in the legal agreement. When we're talking about the equipment they would purchase, that would be for new cars that they're putting together. We would, in fact, require that to be actual new equipment. We'll also have plenty of hold harmless and indemnification agreements on all of that goes into place and putting in the car. The parts we're talking about coming out of our inventory would be wiring and screws and brackets and things like that we typically put on vehicles. It wouldn't be, I wouldn't like to call it equipment. That will all need to come from their manufacturer.
Right, I'm with you on that. As long as you got us covered, Kyle, that's all I care about, as long as we covered.
Yes, sir. We also, like many shops, we will not be endorsing or providing the warranty on that equipment when it comes in. That's already been addressed in the draft legal agreement that we're working on with council on.
Okay, Commissioners, other questions or comments for Michael or Kyle?
No.
Just for clarification, the town of Oakboro is totally in Stanley County. Is that correct?
Yes, sir.
And that is not a service that Stanley County provides for their municipalities?
It is not.
Yeah, and so I'm guessing that this will help support to some degree the capacity that we're building with our new infrastructure and asset management operations center, as well as the IT facility that we're talking about. So this is somewhat of a benefit to us as well. Is that a correct statement?
Yes, sir. We have plenty of capacity at the operations center to handle this. We won't be doing any IT work on the cars, just strictly all fleet maintenance.
Gotcha. Okay. Very good. I am perfectly fine with the second option that you offered as well, for you guys to go ahead with legal and execute that contract without bringing the particulars back to this board for discussion. And I think I heard.
I'm also in favor of it to proceed.
Yeah. So that's a unanimous, I think. Commissioner KIGER, did you weigh in on that as well? You're muted.
Yes, I did, and I'm fine with that option.
Okay, great. So I think we have consensus across the board on that.
Thank you, commissioners.
Okay, thank you, sir. Okay, we move now to item 4.3 from Innovation and Technology, our monthly innovation report. We're happy to have Debbie Brannon with us.
Good evening, commissioners. Welcome to the innovation report. Let's get this started here. Tonight's innovation report is, as mentioned earlier, is going to be on our ERAP program, our Emergency Rental Assistance Program. But first, let's talk about our Employee Digital Book Club for the month. Our Employee Book Club books are selected to align with county initiatives and the challenges we face as individuals and as an organization. The next two books we will listen to were selected to help increase employee voice and engagement. March's book is Stepping Up, How Taking Responsibility Changes Everything. When we take responsibility for making changes wherever we can, it makes our organizations, our communities, and the world a better place. Often we stop ourselves before we start. The problem seems too daunting. It's another department's responsibility. Other people are the issue, and we can't change them, and so on. So nothing ever changes. This book provides practical advice to combat most typical excuses. It helps us see a way through common roadblocks and enables anyone, anywhere, anytime to effectively bring about positive change by simply stepping up. When one person steps up, it creates a wave of energy that encourages others to join. So listen to this book and learn how to claim your power to change your workplace, your personal life, and the world. As I mentioned earlier, today's innovation report is around the Emergency Rental Assistance Program. The Emergency Rental Assistance Program, also known as ERAP, helps residents earning less than 80% of the area median income who are facing housing emergencies by providing funds to assist households that are unable to pay rent and utilities due to the ongoing COVID-19 pandemic. Cabarrus County was awarded $6.5 million to help Cabarrus County residents. This program aligns with the county's strategic plan's Healthy and Safe Community Initiative. Specifically, it aligns with our goal number 2 of that initiative, to improve the physical and mental circumstances of residents by connecting them to community resources to enhance their quality of life. The Emergency Rental Assistance Program, also known as ERAP, requires an end-to-end program management solution that addresses everything from application, eligibility verification, and case management to delivering timely payments to landlords, tenants, and utility providers. It also requires transparency and federal reporting on the application process and the funds distribution. Over the last month, we have focused on developing a secure application, creating processes for case management and eligibility verification, automating processes to expedite payment to landlords and utility providers, ensuring we collect the information required by the federal government for program compliance. This program was developed using agile practices that involve discovering requirements and developing solutions through the collaborative effort of cross-functional teams. It uses and integrates with existing application resources like our Laserfish workflow and document management system, our Northwoods case management system, and our Munis financial system. The ERAP management system was created in collaboration with the expertise from the County Manager's Office, the Department of Human Services, IT, Communications, Community Development Department, and the Finance Department. The Human Services staff has identified 20 potential applicants, and this week they will work through 10 paper applications and 10 online applications to discover if there are any areas we need to change before we open the application process. When the ERAP program opens, we will offer printed paper applications, and they will be available at the Human Services Center, Cabarrus County Library branches, and the Government Center. The paper applications require data input by Human Services staff, which increases overhead and processing time. So we're encouraging people to use the online application to expedite the application process and reduce administration overhead cost. The online application can easily be completed using a PC, a laptop, a tablet, or a phone. The Cabarrus County Library branches also have resources that can assist with online applications. And here's an example. Our online application process begins with a chat bot, and it simply asks you, welcomes you, and tells you, I'm going to ask you a series of questions to determine if you qualify for assistance. Whenever you're ready, press start. You'll hit start. And then you'll enter that code there just to make sure that you are a real person. You're not a robot like the chat bot that's talking to you. And then it's going to go through and ask you a series of questions. So the chat bot asks the applicant questions, qualification questions, in this easy to understand interaction of a conversation to provide and perform the initial eligibility screening. If the household has experienced a decrease in income due to COVID-19 and the household needs assistance with rent or utilities, they are asked for their household gross income and their household size. A calculation is made to determine if the household is earning less than 80% of the area median income. If the minimum eligibility requirements are met, the application is then directed to the full application. This little chat bot was added to after we had created the application. I'm going to show you the application in a minute, which is more of a 7-step process. But we added this chat bot in the beginning to give people an opportunity to work through and see if they meet the minimum requirements. We felt like this was going to help reduce having people fill out an application and they're not meeting the requirements. That would increase the overhead for our DHS workers. They would receive a lot of applications that perhaps, and they would have to vet that and process it. So hopefully this will reduce the number of applications that aren't qualified and increase those that are. So our online application has 7 steps. The first step is the application. The applicant consents to share their information. And then step 2 gathers the rental property information. Again, this you must be in a rental property to qualify. And in the third step, we collect the landlord information and or the utility information for future payment processing if they're qualified. And then in step 4, we can collect the documentation for the full eligibility verification process. So in this step, if you're on a computer, you can upload, or a tablet, you can upload files from your device. But if you're filling this out on a phone, you can just take a picture of the document and upload it. Then in step 5, the information required for the federal government compliance and reporting is collected. And in step 6, we collect the information on the type and amount of assistance requested by the applicant. And then in step 7 is for loading additional required documentation, your rental agreement and things like that. And finally, the full application packet is submitted to DHS for processing. And as I mentioned before, this was designed to work well on phones as well. Here are 2 examples of the step 1 and step 2 as it would be shown on a phone. You can see the user experience is very clean and simple to follow. And so once an application is submitted, that's when the real work begins for the Department of Human Services. Here is a workflow of what's going to be going on behind the scenes. The application's got to be checked for required documentation. Eligibility needs to be verified and documented in the case management system. And then finally, approved requests are sent to finance for payment through our AP processing system. And we're working to also automate that process so we can just import that data into our Munis Tyler system, so there won't have to be additional keying of that information. So we expect to have a full program launch announcement next week. The communications department's working hard on outreach and awareness of this program. You can text ERAP to 888-777 to sign up for program announcements and information. And Karen Calhoun is on the line here if you have any questions or about the program, or if you have any questions about the application process. I do think that, walking through with those 20 applicants is going to probably show us a few holes or ways we can improve our process, but I'm looking forward to working all the way to the end and get this money out into the hands of the citizens and residents of Cabarrus County.
Debbie.
Yes.
The income, I think, was less than 8% of the area median income. What's that number, or did you say?
It depends on, and Karen can probably address this better than me, it depends on how many people are in the household. So we do ask how many adults and children are in the household, and it's the entire income for of the household.
I can give you the range, Commissioner Honeycutt. It's, if there's one member in the household, it's 46,800. Up to, if there's eight members in the household, the income can be 88,200.
Okay, thank you.
And what other locations did you say these applications will be available for folks that didn't have, access to computers?
Mm-hmm. In our libraries, at the Human Services Center, and at the Governmental Center. And I believe they're going to be distributed to other areas in the community for some targeted audiences. So.
That was what I was wondering, and I'm assuming we have Spanish.
Yes.
Okay. Thank you for that clarification.
Okay. Questions for Debbie or Karen? This is an excellent program, and we are very fortunate to be able to offer this assistance. And if I understood correctly, if we are able to successfully get these funds in the hands of folks that need them, there is some possibility of some additional funds that we may have available once these are depleted. Is that correct?
I was actually going to hop on to mention that, Mr. Chairman.
Thank you.
So this afternoon, I actually just saw House Bill 196 was introduced, and if it were passed, it would make available to us an additional $4.95 million, in addition to the $6.5 million that we have already received. So that's certainly a tremendous amount of money that can make a world of difference here. So I would certainly encourage you to reach out to our local representatives and encourage them to support that bill.
Great. Thank you, Rodney. Okay, any other questions or comments? Well, thank you for bringing that report to us, Debbie and Karen. Hopefully, and our public information folks do an excellent job of putting this information out there. So hopefully there are other people that may be watching in the community that may assist us to also help get that word out there and get these funds in the hands of people that need them very badly. So thank you very much. Okay, we move now to item 4.4 from solid waste. Construction and demolition landfill phase 4 expansion option. And we are happy to have Kevin Grant back with us to discuss that item.
Good evening, everyone, once again. It's been a while since we've discussed the landfill, probably between 4 and 5 years, but we are getting close to filling up our existing cell. So I just wanted to kind of just give everybody an update on the landfill, where we stand. First of all, it's always good just to back off and say, what is construction and demolition waste, since that's what that landfill is. It's not a landfill where you take your residential waste, kitchen waste, bulk waste, things like that. We do have a drop-off area there, but construction and demolition waste is items that you would see that you're tearing down a building. So you're talking shingles, you're talking wood, you're talking sheetrock. If you're renovating a room in your house, a bathroom, items like that you're bringing to this landfill. So that's what that is. The current area that we're currently placing the waste in, based on our last airspace analysis, which we did May of last year, shows us that we've got enough room to last us until about May of 2022. Seems like a little bit of time, but it'll be here before you know it. And that's also assuming that we get about 1,700 tons every month. And lately we've been trending under that number. I think the rainy weather is contributing to that greatly. But it does look like we're holding steady. Got a little nervous last year when the numbers went up, but it looks like it's plateaued. So we're holding steady with that number, which is a comfortable number for us operationally and financially. As I mentioned, finances, the finances are healthy right now. Revenues have exceeded expenses since our last expansion in 2017. A lot of that goes to our staff out there. They do a wonderful job taking care of the equipment. They do treat it like it's their own. When they detect something happening, they notify supervision right away, and we kind of jump on it, and we do a good job with our preventive maintenance activities. So I will knock on wood as I say that, hoping that nothing blows up on us out there. But so far it's been very good, and it's attributed to our staff there. Another thing just to remember that the landfill operates as an enterprise fund. And I also, in part of the package, I've included the balance sheet for you to review, which shows the finance is very healthy out there. Funds currently available, or we do have funds currently available for closing the existing landfill, as well as post-closure costs for all landfill areas on the property. What I mean by post-closure, and if you don't know this, with the landfill in the state of North Carolina, regulations call for that once you stop receiving waste at the landfill and you deem that it's closed and you've gone through the closure activities, you are responsible for the next 30 years to maintain that site. So meaning making sure gates, fencing, you're mowing the property, but you're also ensuring that you're doing groundwater monitoring on a regular basis, as well as methane gas monitoring to make sure that nothing is leaving the premises. And once again, I said we've got money set aside for that. We've estimated $3 million plus would cover that over that lifespan, and we're always reassessing that. But as of now, we do have adequate funding for that. Another thing, when we designed, where we're currently at right now is what we call phase 3. And when we designed and started to build phase 3, we also included the design, a basic design, and we went to the state for permitting for phase 4, which is basically a sister site right next to it. I've included an aerial picture. I think it's on page 166 and a drawing on 167. This showed it's basically the same thing. It's going to be a little simpler design, but the state went ahead and already approved that. The only thing that we're doing right now is we're getting a reissuance from the State Department of Environmental Quality, just because it's been 4 years, just to kind of let them know that nothing's really changed. There's no issues. We don't expect the design to change at all. In fact, we know the design won't change at all. So we should be getting a letter from those folks in about 2 weeks saying you're good to go on this one. So also, like I said, this phase 4 expansion would be less expensive versus phase 3 because a big chunk of the engineering work has already been taken care of. And then once again, like I said, the state's already reviewed this and they're pretty comfortable with it. The hydro folks, which look at any groundwater implications, they're familiar with it as well, so they're all comfortable. We might have to move a couple monitoring wells in the site, but nothing too crazy there. And based on what we've looked at, we're estimating no more than $170,000 to do this project, of which we've got a landfill capital reserve fund of about $386,000. So that should be able to cover that. And like I said, always going forward, this should give us another 5 to 7 years of space out there. Like I said, there's always issues of, the equipment breaking down out there. Landfills typically use very expensive, heavy maintenance equipment, so you're always concerned about that and need to be ready. But that's why we try to do a very good preventive maintenance program out there. The other thing, just for folks to know as well, is not only do we operate the landfill out there, but the same folks also operate, which we call the front of the facility, which I mentioned earlier is the Residential Waste and Recycling Drop-Off Center, which folks, if you want, you can bring, if you don't have curbside service, you can bring your residential trash to us. You can bring recycling if you got extra bulk waste that you're just looking to get rid of. If you've got a mattress, if you've got sofas, things like that, and it's coming from your house, you can bring it to us. We also take, just back off that type of waste. As I mentioned, we don't landfill it up there. A lot of folks get confused with that. We actually take that waste and we truck it down to the Charlotte Motor Speedway landfill. The other thing that we offer for for folks up there is residential recycling drop-off. So we take, used TVs, computer equipment. We take used tires, yard waste if you have that. As we mentioned earlier with the white goods, we take all sorts of appliances and scrap metal. Cardboard, which we're getting an ungodly amount of cardboard these days. And we also take, glass bottles, plastic bottles, paper, things like that. So, so just to remember that that facility up there also supports that, and that's something that if we ever need to close the landfill portion down, we're still gonna have to look for ways to fund that. So, that, like I said, I just want to give everyone a quick review of the landfill and the operations, and that will be probably coming to you very shortly. For approval for the phase 4 portion. We don't have all the numbers locked in just yet, but so we just want to give everyone kind of a heads up of what's coming and how things are going up there. So with that, if there's any questions, be happy to answer.
Kevin, a number of years ago, I know a big topic of discussion was lined landfills. And I think that was primarily household waste. Is that, are linings required for these construction landfills as well?
They are for construction demolition landfills. For ours, we're not required at this point because we're grandfathered, because we've been in operation before that regulation came about in the late 80s, early 90s. Yeah, definitely if it was a residential waste landfill, I would be scared to death to have that with construction and demolition waste. As long as you're monitoring what's going into there, and our folks do a good job watching that as folks dump their trailers and trucks and everything. And then the fact that we actually do groundwater monitoring and methane gas monitoring, we kind of got a good handle on that facility up there. But if we decided to go to a different site, it would require a liner, and that would add cost tremendously. The other thing, and we looked at this probably 10 years ago, we also have old residential closed waste landfill up there on site as well. If we ever decided to connect the two, then a liner would be required, and like I said, that would add cost tremendously. I think that would only be required is if we truly thought we needed to go in that direction. We do have a private construction and demolition landfill that's down off 49 behind Foyles Recycling. That's got quite a bit of airspace as well. So that is available. So I probably would never recommend that, but you don't want to say never. So.
Great, thank you. Other questions for Kevin, commissioners? That's probably another tour that we should take of the landfill.
You're welcome anytime. Just come up on a Saturday when you see it crazy. One thing I did mention is the folks that drop off residential waste, we get about 25,000 vehicles a year that visit the site to drop off items such as residential and bulky waste.
Well, that kind of better explains one of the items we discussed over the weekend about traffic conditions out there.
It can be a challenge on Saturdays. We came up with a couple great ideas. We had a couple deputies when they were up there early in the spring that gave us a couple ideas. And we've kind of had people stage in the entranceway. We kind of cleared some spaces to keep people off of Irish Potato Road. So so it's been much better than it has been in years past.
Great. Any other questions for Kevin? Well, thank you. We appreciate you being with us. Okay, commissioners, I think that concludes our items. Next up would be the approval of our regular meeting agenda. And of course, you have copies of that before you. Do I hear a motion that we make any changes to that regular meeting agenda, or that it be approved as presented?
The motion that we, go ahead, Diane.
No, you do.
I'll make a motion that we approve the agenda for March 15th as presented.
I will second it.
Okay, we have a motion by Commissioner KIGER and a second by Commissioner HONEYCUTT to approve the regular meeting agenda as presented. Is there any discussion? Okay, hearing none, all in favor, please say aye.
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 All opposed, please say no. That motion passes unanimously. And is there any other business that needs to come before the board or any announcements before we adjourn?
Mr. Chairman, if you could, now that we've completed the agenda, I would want to let you know that we will need to continue keeping the Register of Deeds offices closed for the remainder of the week. Again, all of the services will be available electronically, except for marriage licenses, and we're working on that process to maybe be able to do that as well. But for now, to enable us to keep appropriate staffing levels there, we're going to need to keep it closed for the remainder of the week and hopefully open back up on Monday morning.
Very good, thank you.
Thank you.
Our entire staff, particularly IT, has done a tremendous job of accommodating these various issues that we've encountered during the pandemic to ensure that our citizens continue to receive the services that they need, even during those temporary closures. So we thank you for that, and we appreciate what they're doing. Okay, commissioners, any other comments or questions? Okay, hearing none, at this time I would entertain a motion that we adjourn until our regular meeting in 2 weeks.
Motion adjourned, Mr. Chairman.
Okay, we have a motion by Commissioner SHUE to adjourn, and I did not hear who made that second.
Steve, it was me, Barbara.
Okay, and Commissioner Strang second that. Any discussion? All in favor, please say aye.
Aye.
All opposed, please say no. And so we will stand adjourned until our regular meeting on March 15th. Thank you all and have a good evening.